Hi again, everybody. This is Dan Stiefel again with Crystal Health Periodontics, and today we're going to go ahead and speak about the next step in periodontal health, which is unfortunately the beginning of unhealthy gum tissue, and this would be considered gum disease or gingivitis. So we've spoken about clinical health already, so we'll go ahead and move on to the next step. So, as we remember, just a quick overview, just a one-line summary. Clinical health, when it comes to the gum tissue, is going to deal with areas of the gum tissue that are easily maintained and easily cleanable. Now, if that piece of food right there that we spoke about, if that piece of food stays on the tooth for too long, what happens is that bacteria that live in our mouth and call our mouth home begin to eat the food, and they start to use it as a source of nutrients, and they start to multiply and divide. And when that happens, they also start to release toxins, and so those toxins or poisons that get released onto the tooth structure underneath the gum tissue, those toxins and poisons are very irritating to our body. Our body knows how to deal with that irritation in one way, and our body tries to fight the toxins and get rid of them, or to at least stop their growth and stop their progression. So the body tries to do that by sending its defense mechanism to the toxins, and it sends blood to the area. So extra blood cells begin to collect in that area where the toxins are being released, and that leads to an increased amount of blood vessels and bleeding in the area. And that also causes the gum tissue to get swollen. So when the gum tissue swells up, our number, as we insert our probe, our number also goes up. That's how we have an increase in our pocket depth. So in this situation here, we have our toxins being released. Our number has just gone up. We have an increase in bleeding over here, and the number increases because of the swelling in the gum tissue. Now this would be called gingivitis or gum disease. In this situation, we have the food that has been stuck on the tooth for too long, and that became plaque. The numbers here are going to be about 4 to 5 millimeters, and we typically would have bleeding, but we usually would not have any pus. This is the second step in the progression, or this is actually the first step in progression of tissue that becomes unhealthy. So, thanks for joining us today. Thank you very much.